Hi. I'm sure most of you guys know the song. Okay, I'm gonna have to sing this out for you guys, but we will rock you. You know that song? Well, okay, if you don't know that song, then you at least know the song, that they usually play at stadiums. We are the champions, my friends. Da-na-na. Da-na-na-na. Okay, so those amazing songs were sung by Freddie Mercury. And sadly, he was taken away from us early by HIV and AIDS. So HIV and AIDS is a horribly sexually transmitted disease that shortens your life and, if not medically treated, is life-shortening if not medically treated. And according to today, there is no cure, and once infected, it stays for you for life. Most of us in college are happily married with the love of our lives, so we're still getting to know each other people. And so you should often get tested and also ask your recent partner and maybe past partners to get tested with you. I chose this topic because I feel that all of us need an update on what we can do to protect ourselves and our health. Today I will be describing to you what HIV and AIDS are, transmission of the disease into the body, and how to prevent the spread of the infection. How many of you guys know what HIV or AIDS stands for? Oh, okay, good. There's like 4 of you. Okay, well, HIV stands, according to AIDS.com, HIV stands for Human Immunodeficiency Virus. If left untreated, HIV can lead to the disease AIDS, acquired immunodeficiency syndrome. HIV attacks the body's immune system, specifically the CD4 cells or T cells. These cells are in your body to defend your body against infections. It's basically your immune system. So, if left untreated, HIV reduces the number of your CD4 cells in the body, making the person more likely to get infections or infected-related cancers. Over time, HIV can destroy many of these cells and make the body so that it can't fight off infections or disease. Because the body is too weak to fight off infections, it invites deadly cancers. AIDS is the final stage of HIV infection, and not everybody who has HIV advances to this stage. AIDS is, sorry, okay. When your number CD4 it falls below 200 cells per cubic meter of blood, you're considered to have AIDS. Normal CD4 count is between 500 to 1600 cells. You can also be diagnosed with AIDS if you acquire one of the opportunistic infections, regardless of your CD count. The disease spreads only through, specific activities. And you can get or transmit HIV only through sexual behaviors and/or syringe or needle in use. HIV is not spread easily though. Only certain body fluids from a person who has HIV can transmit it. Some of the fluids that can transmit the infection are blood, semen, pre-seminal fluid, rectal fluids, vaginal fluids, and breast milk. These body fluids can come in contact with the mucosal membrane or damaged tissue, or be directly injected into the bloodstream by a needle or syringe for transmission to occur. When it means mucosal membrane is that basically your mouth or your loins, anything that has sort of like a fluidy texture that's inside your body, not the outside contact. However, when people have cuts on their hands, sometimes the infection can be spread through there. So it is highly suggested that you always wear gloves when dealing with somebody who is profusely bleeding. The most common sexual activity that can cause you to have HIV is anal or vaginal sex with someone who has HIV without using a condom or taking medicines to prevent or treat HIV. Anal sex is the most riskiest behavior for the negative HIV partner or receptive. It's more riskier than if you're the insertive one. Vaginal sex is the second highest risk, and sharing needles and syringes used to prepare injection for drugs with somebody who has HIV can lead to the use. HIV can live in a used needle up to 42 days depending on the temperature and other factors. The least common way to obtain it is from a mother or child during pregnancy, birth, or breastfeeding. Although the risk can be high if a mother is living with HIV and not taking medicine, recommendations to test all pregnant women for HIV and start HIV treatment immediately have lowered the number of babies born with HIV. In extremely rare cases, oral sex or putting the mouth into the penis, vagina, or anus, in general, there's little to no risk of getting HIV from oral sex. But transmission of HIV is theoretically possible if an HIV-positive man ejaculates into his partner's mouth during oral sex. Just like there are specific actions that can spread this disease, there are specific actions that you must take in order to prevent. The CDC encourages that abstinence is the only 100% proof way in order not to get the disease. Some things that you should do in order to prevent is to get tested, have less risky sex, limit the number of your sexual partners, and get tested for other STDs. And instead of having all these pretty visuals, I decided to show you guys how to properly put on gloves so that you're not contaminated. Yeah, gloves, not the other glove.
University, proper glove downing procedures. Downing the glove or putting glove on. First, measure your hand using a glove sizing chart. This will help reduce the potential for ripping and tearing. Next, thoroughly wash your hands before downing gloves and after each glove change. Then, pull a glove out of a chipboard box and gently open the glove at the cuff. Extend the thumb crotch to the cuff of the glove. Once the hand is properly aligned in the glove, roll the cuff of the glove down the wrist until the glove is secured. Tearing most often occurs when too much pressure is applied to the cuff. Pulling by the palm where the glove is the strongest will greatly reduce the potential for ripping and tearing. Doffing the glove or taking glove off. Pull the glove inside out upwards, trapping contaminants inside the used glove. Replace the removed glove inside the palm of your opposite hand and repeat the same procedure. Then discard the gloves into a waste container at your convenience.
On a quick side note, I just wanted to let you guys know to always be careful and to make your future decisions with a lot of time and thinking. Thank you. I couldn't really find any video stuff. Did you at least learn something?
That's already said. Thank you. The gloves.
All right, I think if you're going to sing, you ought to sell it a little bit at the beginning during the attention advice. I think most people would probably know Freddie Mercury with a simple reference to the songs. So that's an awkward moment for you, and I think that as a result, a lot of things remain a little awkward during the presentation, and you need to be a little bit more fluid at the start. There's good background information. Your thesis, I think, is I got the idea. I like the point finally that you said you kind of want to have an update on the issue of HIV and AIDS, and I thought that was a good idea. I just didn't hear much that was in the nature of an update. I didn't hear what the current outlook is. I didn't hear any contemporary reference to statistics or anything new. It sounded pretty standard boilerplate stuff on this. Your justification for the presentation seems to be that all your classmates are promiscuous, and so they ought to be careful about that. And that might be true. I appreciate that. I think that because of the significance of the infection and the frequency with which people develop sexually transmitted infections, that there's probably another way to express that, but that's okay. There's an okay layout of what the structure of the speech is going to be at the beginning. That's fine. The definitions of terms are good. There's no supporting citations being provided. So I know that you got the information from someplace, but I couldn't tell you where it came from. The explanation about how the infection works is, very vague and abstract. The discussion of risk factors is probably, well, I'm glad we didn't get all the visuals on that. I got to be frank. I think that was probably a good choice on your part. That there is some statistical data that goes along with that. I think that probably would suggest like the high level risk. I mean, you have them classified into categories, the highest level risk and the lesser risk. That seems to me like that would be a natural for some kind of table graph to illustrate the risk factors. So I don't understand why we didn't get that. In the body of the speech, I don't think that you kind of follow the organizational structure that you set up at the beginning as clearly as you should. And one of the reasons is that there isn't a clear set of transitions between points. It just feels like a random series of ideas that you're going through at any given time. The visual materials, you only have the one video clip at the end, and I thought that, look, it explains the appropriate way of putting on and taking off the gloves, but that was like one tiny section of your speech, but it gets the only visual material in the presentation. That felt a little bit awkward, and it just feels like it's an afterthought as a consequence rather than something that's well integrated into the presentation. And your delivery you get lost a lot because you're doing a lot of reading. And anytime you lose your place on the notes, then it just draws attention to the fact that you're reading too much. This is like I said, it feels like you wrote a script and you're reading us the script instead of giving us a speech, and I do not approve, as they say. We're going to discourage that behavior. I'm going to ban the podium. I'm not going to let anybody use notes for the rest of the semester. This is we're going to be done with this. All right, thank you.